In many societies in Africa, discussion of sexuality, the beginning point of maternal and reproductive health, is a taboo. Yet it's such discussions that are the basis for informed decisions of the well-being and the health of families. In many African countries, many mothers are below 18, yet their bodies are not mature enough to withstand the rigors of childbirth. But early marriage is a culture that is widely condoned.
And therefore, most times the pelvis is small, so the babies can't pass out easily. Then this ends up in obstructed labor. Obstruction means there's damage to the bladder, which ends up with what we call obstetric fistula, or damage to the rectum, which ends up with rectal fistula.
Other traditional norms and practices, though cherished by many, also have a bearing on maternal health. For instance, female genital mutilation can lead to obstructed labor, leading to the possible death of mothers.
I delivered a lady who was barely about 18, 19 years of age, who came in with an obstructed labor. And when I wanted to examine her, what I found was a very small, narrow passage down there, which could not even fit my finger. The baby was stuck, could not come out. So the option we took was instead now to take her to theater and do cesarean section.
Some cultures condone sexual abuse where defilement, rape and unsafe abortions are handled quietly within the family. In many cases, taboos do not allow pregnant mothers to eat certain foods like chicken. But lack of traditional foods in mothers could lead to babies being born with deficiencies that can lead to death. However, traditional leaders say both culture and modernity could work hand in hand, and some researchers agree to this.
The goal is to have an African hospital with traditional medicine and to teach people how to cure with local, medicine.
I think bringing the modern and the cultural together is a very important, because some of the cultural aspects are emotional comfort for the women, and therefore bringing them together is quite important.
In all, culture is still cherished in Africa, which means it must be used alongside modern methods for better maternal and child health. Isabel Nakiria, NTV Tonight.